Frequency for PRP hair loss treatments? Does it make much of a difference if you go 4 to 8 weeks between treatments? Some places recommend 4 weeks, some 8, and others are in between. Will a PRP injection lose any effect in essence the longer you wait? Would it be more effective to have treatments closer together?
Thank you for your question. You submitted your question without a photo, and essentially you're asking in your question about the right frequency in which to get PRP treatments for hair loss. And you state that some places are recommending every 4 weeks, some places are recommending every 8 weeks. You're asking, will the effect wear off if you don't do them more closely together? So I certainly understand this confusion, especially since there is now truly a growing popularity in the use of PRP for hair loss. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed starting from over 7-8 years ago using PRP and a material called acellular matrix to help men and women with genetic pattern hair loss, and has been very successful, and we treat patients from all over the world. So I certainly can share with you my perspectives on PRP as well as what kind of effect it has on the treatment of hair loss. So to begin with, I think that one of the challenges that faces most physicians today who are relatively new, and I would argue that it really accounts for the majority of physicians, because frankly, when we were doing PRP for either skin rejuvenation as well as for hair loss, there was a lot of resistance in a lot of our colleagues and a lot of dismissiveness. Well, fortunately, the medical literature and some of the dermatology publications have recognized what was already obvious to us, that PRP does have benefit in many places, particularly in skin and for hair loss. The question remains with those who are offering PRP as to what the optimal protocol is. And I think the reason why there's confusion is because in terms of hair loss treatment to individuals, it's individualized treatment. And what I mean by that is you're dealing with male and female pattern hair loss. You're dealing with a wide range of ages of onset and degrees of progression and rates of progression. So constantly I see how people are trying to figure out a one-size-fits-all approach to treating hair loss. So to begin with, just a little bit of background on how we developed our treatment. We were using acellular matrix and PRP to help our patients heal after hair transplant. We wanted the graft to heal better and the donor area to heal better. Well, a very pleasant side effect was that thinning hair became thicker in some of these patients. Over the course of several years, I developed systems and protocols based on clinical examination and watching our patients every 3 to 6 months to develop protocols to help both men and women with hair loss. Further, at this point in time, I've developed a classification system for hair loss, because I think that one of the frustrations that we all have when we don't see as good of an outcome as we expect, we wonder why. Well, I've developed a system based on gender, age of onset, degree of progression, rate of progression, and other medical variables. And I think this is what gets confusing when it comes to just using PRP alone. The literature has already substantiated that PRP has many valuable effects on hair loss. However, what is not being factored in is the individual hair loss profile. some people may respond better than others. And currently, the prevailing opinion is that it works 50%, that PRP works 50% of the time. I think the numbers are too small and the experience is too little to really make a statement like that. I think what you have to understand is that PRP alone has a certain stimulatory effect on hair growth. The mechanisms are going to be much more than what we currently know, but in terms of timing, this is a challenge to the sustainability. Why do I say that? Because when we see patients who have gotten PRP injections done elsewhere, typically they will have gone for once-a-month treatments for about 4 months, after which they feel very frustrated because they're dealing with the discomfort of getting injections most of the time without anesthetic in the scalp, and they're not seeing a horizon as to what the outcome will be for how long. Basically, it's very challenging to have a sustainable improvement when you have patients come every month for scalp injections. And scalp injections can be very uncomfortable. In our treatment strategies, what we do is we develop a treatment plan based on the individual's hair loss profile. And what I think the take-home message is that hair loss is managed. It is not cured, it is managed. And based on the hair loss profile, you use multiple tools to help manage hair loss, and you customize the plan. So when we see our patients, we generally will do maybe one injection for the duration of several years. We may do 2 injections, a second injection called a booster injection, anywhere between 12 to 24 months after the first. But for practice like ours and for the TrichoStem Hair Regeneration Treatment Center, we treat people from all over the world, and it's impractical to have people come back monthly. So I think we've just been further along in our development based on our own internal clinical observations and developments. And so I would say that to answer your question without a full evaluation, I would say that you can, to a degree, expect PRP to cause short-term stimulation of hair growth. But at the same time, you have to look at other variables that also impact the progression of hair loss. So I think this is a discussion to have with the doctors. I think you should ask, how much experience do they have doing this? What's the outlook? Whether it's the 4-week or 8-week plan, what can you expect, and what else can you do? I think that very often people just get frustrated, and what I want to do is to help people understand that there's more to this than just frequent PRP injections. Hair loss is more about management and not just a single approach that can work some of the times for some people and not work out for others. There's much more to this. So I think it's important you do more research, learn about platelet-rich plasma, acellular matrix, and protocols, and most importantly, learn about the experience of the practitioner that you intend to go with so they can guide you based on their experience. We're using our experience going on for 7 to 8 years that has really informed the evolution of our treatment system such that we are where we are today from frontline, real-time experience. So I hope that was helpful. I wish you the best of luck. Thank you for your question.